If you want to know how this woman sold her first business to ICICI Bank and her second business to the British publishing giant Pearson, watch this till the end. Very few know this hidden secret, and you'll be shocked to know that Meena Ganesh, whom I interviewed in this video, was the actual brain behind the idea of Big Basket and still holds shares in the company after Tata acquired it. Not just this, you might have also heard of the famous jewelry company Milestone. That was also Meena's idea. Currently, she is running a profitable platform called Portea Medical for more than a decade to deliver healthcare services like physiotherapy, senior care, even ICU services at your doorstep. With a 100% success rate in the startup world, Meena has been on Fortune India's 50 most powerful women in business list for 7 consecutive years. If you are a startup founder, business leader, or even a curious learner, in this interview you will learn how to run a profitable business, get your first big client, how to invest into smarter people and make millions of dollars, and lastly, watch my guest Meena disclose her secret behind having a Midas touch in this interview. You were the first one in India to build home healthcare service like this, and after you built, other bigger players like Apollo, Max Healthcare actually joined the bandwagon.
In initial days, it was difficult to make people feel comfortable that they can get really good quality healthcare at home. We have probably 10 million patient visits by now, cumulative over the years. We have 3 businesses. So far, we have spoken mainly about the home care business.
Correct.
So that's 40-45% of our revenues come from there. Then we have the medical equipment business, which is 30%. Then we have a pharma business where we work with some of the top pharma companies. Service margin will be typically in the 30%. Similar margin profile as the healthcare services. Pharma distribution will have lower margins.
The cost that you charge versus the cost that a hospital would charge in terms of services, how does the cost differ?
When you put a solution like this, the cost of that at home is probably 1/3 of how much you would spend in an ICU per day.
In terms of like your business model as a whole, you charge the patients and of course you pay salaries to these doctors.
That's right.
What kind of margins you make as a business?
Gross margin, the business typically is about 30%. We are EBITDA positive, so we are breaking even, and off late we are profitable.
Why should a customer choose Portea over the others?
Well,
in terms of the collaboration with the hospitals, what kind of revenue share do you do with them? What kind of returns do investors make in this kind of business?
So,
Hi Meena, welcome to our show Radically Yours.
hi, so nice to meet you, Radhika.
I mean, you spent more than 2 hours in Bombay traffic today.
Oh gosh.
It's not the first time that any guest is coming here facing that, traffic. But how is the journey been so far for you? Are you feeling better now?
Well, just shows how committed I am to come in and attend your show.
Yeah, exactly.
You have to give me a special medal for this.
I have to, and I think this episode definitely should be watched by many people now, especially that you have taken so much of efforts to make it today.
Yeah.
But I'm gonna, energize you because you've had a very tiring travel by asking you like a 60-second pitch for your company, so that the audience also knows, what you are building and what's your vision. So, starting with the first question, mention Portea to me in one line. What does it do?
So Portea is an outside of hospital healthcare company.
And what was your vision when you started it? What was the problem?
Yeah, so that is not a one-line answer, I'm afraid.
Like the key problem.
Well, the key problem is that much of the healthcare in India was restricted to hospitals or facilities, but actually the care that you need, healthcare that you need, and the recovery from any episode happens at home. But there is nobody who you can rely on to support you at home for your healthcare needs. So that was the problem statement, and that's what led to this.
And how many patient visits did you have back in 2013 when you started, and how many do you have now?
Well, I had one because that's how we start, okay. But jokes apart, yeah, we start in 2013 is when we started the company, and slowly over the years we built it up. We have probably done more than 10 million patient visits by now, cumulative over the years.
Got it. And what's been the biggest challenge that you encountered in your journey in building Portea?
So this was a new concept altogether. So in initial days, it was difficult to make people feel comfortable that they can get really good quality healthcare at home. And on the other hand, hospitals were always a little wary of letting their patients get care at home. So from both these very important stakeholders had to be brought on board and make them comfortable with
yeah, to convince them was the toughest part. And what's been the biggest win for you in Portea?
Well, I think we've created a whole new industry. This did not exist. The big win today is that it's sort of assumed, and all hospitals and most people assume that healthcare can be done at home. And that's a transformation that has happened over the last decade.
Yeah, the revolution is what you've created. But today, like, we have many other home healthcare services as well. So why should a customer choose Portea over the others?
Well, we have a brand that stands for very good quality, consistency, and we've been at it for the last decade, and people know that we stand for something. So that's a good reason for people to come to us. And we constantly innovate as well to add newer and newer services that customers need. So for a customer, it's a one-stop shop. You go to Portea, all your healthcare needs that you need at home or at work or wherever, basically something which doesn't have to be in a hospital, that gets done in one place, and that makes it very easy for them.
Yeah, and which has been the most used service in Portea platform?
So there are two things which are pretty big for us. One is that a lot of senior citizens need continuous care. People who are either they're ailing or they're just so old they need continuous care. So that's one segment which is big for us. And the other is that the people who have pretty critical illnesses, they were in ICUs or they were in hospitals, they need to recover, they need nursing services. That's a qualified nurse who sits with them and makes sure that they recover over a period of time. So those are the two key services that are big for us.
Got it. Well, that was a good roundabout of what Portea is doing right now. And I'd like to now dig deeper into different questions as to how you built Portea. But let me start by, since you said the problem is much vast and couldn't be explained in just one line. So why don't you tell me what was the key problem that you saw in 2013 while building Portea? Because you were the first one in India to build a home healthcare service like this, and after you built, other bigger players like Apollo, Max Healthcare actually joined the bandwagon. So I'm sure you've created a disruption, but tell me why and how did you do it?
Sure, no, that's a very good question. Actually, even before 2013, I had always seen healthcare very closely, and I was looking after the healthcare needs of my parents, and I realized that hospital care was great. My father was diagnosed with cancer. He passed away in 2010. But at that time, I used to take him to the hospital, things used to get done, all his surgeries, treatments, all of that. But when you come home, and that's where most of the time he was, and I needed to care for him. There was nothing which was of any quality or anything that I could rely upon, and it used to be a day-to-day struggle. So I realized that there was something very clearly missing there. So in 2013, when we exited from our previous venture called Tutor Vista, which was into the education space, we sold that company to Pearson. So we're looking at what else should we be doing, and I was still keen to do yet another startup. So then healthcare was always a space of interest. So on studying it further, then I realized that what I was experiencing is what a lot of people experience. A lot of hospitals also believe that there is something needs to happen at home, but they don't have the ability to do that, and it's not something that hospitals are very good at. So
why didn't they have the ability to do that?
So the thing is that hospitals by nature are set up to maximize their revenue per operating bed. It's a very high capex business. They set up those hospitals, they've invested in those, they want to maximize the return on the beds.
Yeah.
Trying to manage a team of people, sending them home, managing revenues from patients over long periods of time, that's not their model at all. So they really struggle to do that. In fact, one of our first clients turned out to be Manipal Hospital.
Okay.
They had a small home care unit, and they realized once we approached them, they actually liked the idea. They said, okay, you guys take it and run it. So since that time, we've been running the entire home care unit for Manipal over the last decade.
What did they have when you approached them, and how did you add on to it?
Yeah, they had a small unit of nurses that they had. The nurses used to work in the hospital. They said, same nurses we'll send. They had a little team who used to talk to the patients, send somebody, trying to manage that. They were really struggling.
Okay.
But what we came in is because this was our primary business. So the moment we came in, we put in the entire technology platform in place, because it's a remote work. So many people are going to be going from their homes directly into the customers' homes and servicing the customers there. And we need to know how that's going on. So the entire journey of customer acquisition to servicing the patients to managing the lives of our clinicians, all of that, we said we need to invest in a platform. So that was one of the first things that we did. So having a very strong technology play and understanding of medicine, because we also got a very senior healthcare leader to join us as a part of our initial team as one of our top leaders. So getting technology, ops and medicine together was something that we were bringing to the table, and that was very useful for hospitals to take on. So in fact, initially we did both the things. We started B2C, so directly we used to get customers, but we also used to work with a lot of hospitals. Yeah.
And which segment performed better for you? B2C
both
or
of them both are important. Even today we have good 40 to 50% coming from each of the segments. So they are equally valuable for us even today.
Yeah, understood. And when it comes to hospitals, like what kind of volume do you get in terms of the patients vis-a-vis, one-on-one customers that you get through the platform?
So like I said, they are pretty much equal in terms of size of business for us. Over the years, with the brand name that we have created, so our B2C continues. We get a lot of customers through patient referrals. So existing patients would refer, our clinicians could refer the patients. So both of those get us good 20% of our customers comes through that. About 35 come directly, and the balance come through our relationship with hospitals.
Got it. And in terms of the collaboration with the hospitals, since we're talking about that now, what kind of revenue share do you do with them? Like, how does that
So we do share, because they are providing, so when the hospital gives us a patient, they are also providing a medical oversight for that. So we do pay them consulting fee for the revenue, the medical oversight that they provide us, and that is the revenue share that they get for this.
Okay, got it. And they don't pay anything else to you?
No, I mean the customer pays, the patient/customer pays us directly. And we pay a revenue share in the form of a consulting fee to them.
Got it. Oh, so they just tell the patients to use your platform?
That's correct, yes.
Okay.
Exactly.
They don't like buy your platform in bulk and then sell it. Okay. Understood.
No, the patients are directly contracted by us. And we provide the service end to end to the patients.
Understood. And then what do you think is the pending problem still in the home healthcare services which is yet to be solved?
So this is that's a pretty big question. See, the thing is that the problems, the patient's health needs are constantly evolving. Now, if you look at it today, if you're elder care, if you look at the senior citizen population today, dementia is starting to really become quite large in volume, and getting a really good solution for that is something that all of us are working. It's tough. Even families struggle to manage the dementia patients, and as it gets worse over time, it's a real struggle to keep them at home. The behavior modification is an issue. So there are a lot of challenges that they work with. So getting the right kind of trained manpower to provide them support is a problem that we are still working on and trying to solve that for them.
But how do you think that can be solved? How can we get skilled manforce?
We have to skill them. You can't get skilled manpower directly for that. So you have to create a special cadre of people who are willing to and are capable of serving dementia patients. So if you have a normal elder or a sick person, you need to just basically care for them, have that good empathy, make sure that you're giving them medicines on time, making sure that they are safe, and take care of their hygiene, or if it's medical, then you provide the medical support. But when you have a dementia patient, most of the time the patient's behavior is not so easy for a carer to handle. So you need an extra skill to know how to handle a dementia patient and provide and make sure that they don't get very aggressive or get into a mode of not eating, not doing anything, not taking care of their hygiene. There are many kinds of problems. So that requires special training, and we have just started working on creating that new cadre of patients for carers for dementia patients. But for an industry as a whole, it's an industry which is growing, which is maturing now. But and so there's always a demand for additional manpower to serve the patients. So there's always a supply issue.
Correct, exactly.
Yeah, that's a perennial problem as such.
But how have you been able to solve the supply issue so far? Because you've been operating since more than a decade now, and especially during the COVID, when the demand was so high and you had limiting factors geographically, how did you manage to get the right manpower in the homes of different geographical areas?
So we, as you know, we have offices in 20 plus, so we have full-fledged offices in 20 plus locations, and we serve nearly, I would say, 60 locations as in a hub and spoke model. We had the recruitment of the various kinds of manpower that we need. We need doctors, we need physiotherapists, we need nurses, that is qualified nurses, we need caregivers, which are called nursing assistants. For each of these, over the years, we figured out what's the best way to hire. It's a lot of trial and error, a lot of failures, a lot of challenges. After all that, we have sort of got a fairly good handle as to which geography, where we can hire from, which institutions, how do you train them, how do you make sure that they enjoy the work that they do. We monitor the quality of their work. So it's a journey. I mean, over the years, the recruitment, training, day-to-day management, quality control, all of these have evolved over the years, and using technology a lot for each of these spaces is very important.
But give me an example, like for example, if we pick up Bangalore only, how would you identify the right skilled talent for the supply side?
So the recruitment team knows where to get people from. For instance, physiotherapists typically we'll hire locally. But when it comes to caregivers, we'll probably hire them from more interior location, such as we get them a lot of people from Jharkhand, Bihar, and as well as, of course, we get a lot of local people from, not from the main city, but from the smaller towns, because those are the people who are interested in moving into the big cities and picking up a career in this space. So we hire them. NSDC, for instance, National Skill Development Corporation, has got training programs to train people for becoming caregivers. So we would hire them, and then we would train them for our standards. Then when it comes to nurses, qualified nurses, there are specific locations, like Kerala is known for nurses. Then I think there are like that 5 or 6 spots where northeast there are some good nursing colleges. So we know where are the good nursing colleges. We'll hire from them, or we'll hire from market experienced nurses.
And
so
when it comes to critical care support, especially in the ICU,
those are very highly trained nurses that we typically get from the local market. So the people who are interested in taking on this role, See, interestingly, we've seen now a decent migration from the hospitals to home care because people find that this is a comparatively easier job because you're in one place, you're looking after one patient. It can be much physically less taxing. They earn quite well.
But do they earn better than what hospitals would?
Yeah, I mean, it will be on par or maybe a little better. On occasion. And the other thing is that for those who are ambitious, who really care about their work, here you get full autonomy to be with the patient and really care for them. Unlike in a hospital where you are just a cog in the wheel and somebody will tell you, ye karo, wo karo. Here you are treated with respect. You're the one who is on the job. So it's a much more fulfilling
But
clinical
what
work.
promotional levels do you offer as a platform to these skilled laborers? Like you said, they're always very ambitious, so they might want to look forward to more. So in terms of the pay, do you like hike them up, or how?
So we have all that. We have a standard basis, the number of years of experience. Salaries are modified. There are they move from L1 to L2 to L3 category nurse based on the kind of experience they have, the kind of qualifications that they can go study more, they can come back, we can get them trained on specialized care, then bring them back, then they can grow within that. Some of them grow to become team leaders or coordinators. So there are various ways in which they can grow within the organization.
Understood. And like, coming to the cost that you charge versus the cost that a hospital would charge in terms of services, for the benefit of people who are watching, and for people who think that how hospital and out of hospital care are different, I want to ask you on different services, like how does the cost differ? So when it comes to like physiotherapy, how much do you think is the difference, and how much do you charge and how much would a hospital charge?
Pretty much similar. It's in
similar.
fact, it's very similar. There is not much of a difference really. So in those kind of services where you, if you get a physiotherapist home or you go to a hospital, a good brand name hospital and get the therapy, probably it will be similar. However, if you were to, if a patient was in a ICU for say they may be 10 days, 1 week, whatever, and they are now stable, hemodynamically stable, but they need a lot of monitoring, then we can set up a full-fledged ICU at home, where you put in all the equipment that they need for monitoring. You could, if they need a ventilator, they need a multi-para monitor, they need a DVT pump, what have you, medical bed, etc., etc. And we put a L3 nurse there, a very senior nurse, and an emergency care physician monitors from remotely. Now, when you put a solution like this, the cost of that at home is probably 1/3 of how much you would spend in an ICU per day.
Correct.
So it's a much cheaper kind of service at that level. But on a day-to-day for any services like physiotherapy, call a doctor home, etc. If you call a doctor at home, it'll probably be more expensive than if you go to a clinic. But if you get a nurse to come again, give an injection, or you want to get a physiotherapist, etc., it'll probably be similar. Now, something like getting a carer at home to look after an elderly patient, there's no similar service that a hospital will offer, so you cannot compare with that.
Yeah, exactly. And in terms of the, telemedicine, the consultation that you offer, is that also the same as what you would pay for a doctor consultation at the hospital?
So if it's a teleconsultation, it probably would be similar or even cheaper. But we send a doctor home physically also. When you send a doctor home physically, it'll be more expensive.
Like how much more? 20-30%?
Yeah, something like that.
Okay.
Yes.
Got it. But necessity is the mother of invention.
Yeah, I mean some very, very sick people or old people, they need the doctor to come home.
Correct.
Yeah, and we also don't promote that as, call the doctor for anything, because that's not right, The doctor's time is so valuable, and they are very difficult. The availability of doctors is limited. So only if elderly patients who need a doctor to come and check on them, we would send. Otherwise, teleconsultation, or you consult your doctor and then we will come and pick it up from there and take care of the treatment thereafter.
Got it. And in terms of like your business model as a whole, you charge the patients, and of course you pay salaries to these doctors.
That's right.
So like what kind of margins do you make as a business and the home healthcare segment in general, what is the kind of margins people
at
are
the
making?
gross margin, the business typically is about 30%, and we are EBITDA positive, so we are breaking even, and off late we are profitable. So
yeah, but like just for better understanding, if we could just pick one example.
That's why I said it's about 30% gross margin.
In 30%, okay, got it. Which is much better. And how much do hospitals make in this case?
Hospitals, as I don't have the gross margin level, but if you look at the PAT level, hospitals struggle a little to make very good margins because
capital cost
it's a very high capital, so the depreciation etc. tends to be quite high, and that's why utilization is very important for them of their equipment. They have very large equipment, very expensive beds, so the margin, their profile is a little low in that case.
Yeah. So do you think, like, as an investor, ideally, who has a lot of money, they should invest more in home healthcare services than hospitals?
There are different benefits of investing in both of them. So I wouldn't say that you should compare one with the other. But by itself, home healthcare is a good industry for people to invest in, no doubt about that.
Yeah. And it's like, what kind of returns do investors make in this kind of business? Like, what kind of exit opportunities can they expect in this business? One can be, of course, strategic M&A.
Yeah, strategic M&A, IPO maybe. Both options are there. But remember that any healthcare is a long lead item. It's not one of those invest quickly and in 2 to 3 years you can exit. It's not. It requires patient capital.
Yeah, that's true. But you mentioned that elder care is the most used service in your platform.
I said one of the most.
Yeah, I mean, which
elder
are the
care,
others?
and the other one was, I was saying, post-hospital care and recovery. Those two are big for us.
Understood. But you know, in other markets like US, UK and Japan, this senior care industry has already developed, and even in Asian markets like in Singapore, it's growing. But in India, it's like still at a very nascent stage. Why do you think it's not like as much as it should be? Because the growing population in terms of the people above 50 and 60, it's like a lot in India, and it's expected to double by 2050. So, like, why do you think that there is this gap which is still there, and how can we cater more to the demand?
Actually, I would say that in the last decade, this has changed a lot. So, you're right, because one of the reasons why elder care as a separate offering had not picked up in India this far is because families were sort of looking after their elders. But as a lot of the families have become nuclear, and children are in different countries or different cities, are not willing to take care or not able to take care, all of those possible situations, and elders are on their own. The requirement for something which will take care of them has now started to become more mainstream. So the two different models are emerging. One is caring for them at home, which is the model that we offer. The other is elder communities. Those are also emerging. So elder care, and what we offer is elder health care. Now there are other startups which are coming up which are providing other services like travel for seniors, entertainment for seniors, or providing them with concierge services, a ticket book karao, ye wo. So there are different kinds of things that are emerging because the elders are starting to show a lot of interest in taking care of themselves rather than relying on children or nephews and nieces. That's I think they have enough money to spend and they're willing to take care of themselves. So when you get into that stage, then there is an opportunity for elder care companies to grow over here.
Understood. And what's like the most expensive service on your platform?
It's like difficult to, it depends on the requirement, but I'll say the one which will be most expensive for people, if there's somebody who's really sick and they need a nurse full time, and it's a very senior nurse and they need the nurse 24 hours, that would cost them a lot of money on a monthly basis.
Yeah, and like do you charge on an hourly basis or
it's a daily basis?
Okay, daily basis. No matter how many hours do you use the service
There
for?
is no, we don't send people for 1 hour or 2 hours. We'll send them for 4 hours, actually mostly 8 hours or 24 hours. So it's either actually 12 hours or 24 hours. Either they come for 1 day or for they stay with you. And so it's a stay at home kind of service. Those are the two models. Things like physiotherapy, of course, is on, that's not on this basis. So that's on a visit basis.
Correct.
There is also this nursing, which is a short-term nursing, as we call it. Somebody needs an injection or an IV to be infused, etc. Those will happen on a visit basis. So either it's a visit, in which case you pay for the visit, or you pay for a 12-hour or a 24-hour.
Yeah.
That's the model.
Understood. And of course, this is very subjective in terms of the pricing, but on an average, can you just mention the pricing models that you have?
No, I don't want to give pricing on a,
No?
on a podcast because it's crazy.
Because I also tried checking on the website.
People
and
will
they
have
were like,
to call.
You call
Yes,
us
you will have
and
to
then
call.
we'll tell you.
Exactly, because we need to know where are you come, which location, what service you need, what critical nature of this the requirement is. So I cannot give prices like that.
Yeah, because I also tried checking and I'm like, nahi, ऐसे तो नहीं. Demand होगी तभी बताएंगे.
No, it's not just that, because we have to qualify your requirement and tell you what you need for your
but like, how do you verify the authenticity of the patient कि जो वो बोल रहे हैं it's the truth before sending somebody?
So so the thing is that for something like physiotherapy or where a lab has to go and pick it up, once the patient explains what they require, the clinicians themselves have the ability to go and then examine. And if what you're saying is what you need, then they will provide the service, otherwise they won't. So that's very clear, because they have the ability to discern and decide so they are clinicians themselves. So a physiotherapist is trained. I mean, they are like they go through the similar kind of medical education. So they can come to your home, examine you, and then they know whether you really need the service or not. And for the most part, we don't see those kind of challenges that, I mean, in earlier days, we used to have people, they would just say stuff. But now we have a very detailed questionnaire that our call center people would ask, understand, qualify, and then provide that information to the physiotherapist, who then go there, and normally that's not a problem.
Understood.
But when it comes to, let's say, a caregiver that's an elder needs, then typically a coordinator would go along with them. They will assess the condition of the home, because these people are going to be staying there for maybe for 12 or 24. So they actually assess and make sure that they feel safe, comfortable, and then they leave them there. So that's an important part of our placement process.
Yeah, exactly, because you would want your service providers also to be in safe hands.
Yes.
But has there been any such case where things have gone unexpected in an unexpected way?
No, sometimes, very rarely we have, and then we pull our people out, because they know who to call, and we'll just come and take them away. But not too many. Very rarely we have. But then human beings, right? You have to make sure that you're taking care of all eventualities.
Right. And how do you maintain data privacy in all of this? Like, I'm sure that a patient must be concerned about giving out their data to somebody strange. So how do you maintain all the records and make sure it's
we have our own platform, like I told you right up front. We had built a very robust ERP, if I may call it that, for managing our entire business end to end. And the data in that is protected. Our call center clinicians, nobody can directly call a patient. So the phone, if they have to use only the app to make any connect to the patient, so they don't get the phone numbers and data of all the people. It's well protected in our database, and there's restricted access basis their needs, and the medical data is not made available to anybody. Only it's kept very closely, and only those on a need to know basis it's made available. So there's a lot of effort to make sure that data is kept safely and private.
Got it. And are there any like legal and regulatory issues that come into this space, or something that you have to really take care of? Because to set up like ICU units and all at home, a lot of licenses I'm sure you might have to take, or how's the process?
So basically some of the states have what is called as a Medical Establishment Act.
Okay.
So if you have the state has a Medical Establishment Act, then our center, our branches there have to get registered under that act, which we do that. Now, as far as service at home is concerned, the individuals that we send need to have the right licenses, and they have to have the for instance, somebody who's a medical practitioner needs to be able to practice in that state, so you have to have a license to practice in that. A nurse needs to have the license to be a nurse. So those registrations are all required, but there is and then the medical equipment has to be appropriate medical equipment. It has to have all the CE marks and what all that is there, but there is no license that has been defined for doing home care services. So there's nothing of that nature that is available.
But you think there should be one?
So the thing is that even clinics, you go to a clinic also, they are all registered as under the if like Karnataka has a medical act, so under that it's called medical establishment. So it's the same thing. So there's no difference between that.
Understood.
Yeah.
And you all also do equipment leasing, right? So how does that business work?
So same clients, many cases same customers, or it could be different customers. So we do two things. We lease as well as we sell equipment. So those that need equipment for a short period of time, and there's a lot of respiratory equipment or hospital kind of setup they want to put it in their homes, or they may just want a oxygen concentrator for a month or two. So those things we rent out to them. We keep a inventory of that equipment, and most of our key centers have them, and we lease it out to the people. When they're finished with that and it comes back, then they're serviced, they're cleaned, sanitized, and kept back in our inventory, and then sent it out to the patients again. Then we also have, like I said, sales stock for certain products which people prefer to buy outright, then we sell that also.
And then do you also have some checks and balances before you give it out to people, the equipment?
Yeah, of course. So all the equipment, there's a quality check that all the equipment has to be, has to go through before it gets out.
No, like in terms of the people who are ordering it, like do you check who's the person who's ordering it, because there should be no misuse of equipments?
No, see, that is on, if somebody decides that they want to order a oxygen concentrator, they want to use it, that's up to them. They want to buy it from me, they're welcome to buy, and then they can do what they want with it. It's like, you can buy it on Amazon, you can buy it anywhere. So you can go to nobody is going to do that. But when we lease something to someone, then we will go there and make sure that they know how to use it, because we're giving it for use. But if someone just buys it from me, that's they have decided to buy. I don't have any liability in how they use it. But if they're going to use it in their homes for and they've asked me to provide it to them and on lease basis, then I do.
Because you're going to take it back, so you have to ensure that it's in proper check.
But if somebody has bought an equipment and asks me to also show them how to use it, then absolutely we will go. But if they just buy it to take it somewhere and use it wherever, then I don't know. But if they're saying that I want to use it for this patient, please come and show me, then we would. For instance, if there's somebody is setting up there's an elderly who needs multiple equipment, and they have contracted us for nursing or a caregiver and equipment, then we'll go and set up the whole thing for them. So that's what I said, that we can provide a full one-stop shop for them. So it makes life very convenient. You go to Portea, you get the entire thing sorted for you.
But in terms of the, the renting business of equipments, what's the margin there like?
The margins are very good in that.
Like 50%.
And so there, the way, more than margins, what is meaningful to see is how long does it take for you to recover the capital cost. And typically in 2 years for some equipment and 3 years for some equipment, we can recover the capital cost. So it's pretty good.
And the lifespan of their equipment
is more than that. So it's a good business to be. But then you have to invest upfront, so you need capital for that. We wanted to do multiple startups. So we started Bluestone, Big Basket, Then Portea in 2013.
Bluestone you started?
Yeah, Bluestone. We are promoters of Bluestone.
Oh, is it?
Yeah, and so we have done like that about a dozen startups we have promoted. I ran Portea also as a CEO, but I was we are promoters and investors in all these others, and I've been supporting them as well. So.
Oh, and
Yes.
Big Basket, how did you become a part of it?
Because we were the ones who came with the idea.
Oh, really?
We set up that whole concept of grocery ordering, Ganesh and I, and we have another third partner, Srini. Three of us said, oh, and that's a big trend that's going to be important for India. Let's work on that. Then we said, let's get a team. So then we got hold of the old Fab Mall guys whom we knew, Hari Menon and Sudhakar, and we spent many months convincing them. Then finally they said, okay, fine, we'll come on board. And that's how Big Basket started. Then we convinced the first investor, Ascent Capital, to come in, and then Big Basket. They of course were the operating team, but we are the promoters, and we provided the strategic advice right up front.
And you all are still holding shares in Big Basket?
Yeah, a little bit. Because after Tata's, much of the exit happened, but we still have some stake. Yeah.
Oh, that's super cool. I didn't know that.
Yeah.
And that Bluestone how did it happen?
Same story.
Same story.
Yeah.
Y'all had that idea and you found the operator.
We found Gaurav, told him to come on board, and then the company took off. Then the first investor also, Axel, we helped in getting that. All the other companies are like that only.
That's so nice.
Verloop, Hungerbox, Home Lane. All these are companies you started.
So many you started? Because you had the idea and the network to run it.
That's right. Yeah.
So you just wanted people who could execute.
Correct.
Oh. And you didn't execute in any
Only Portea.
Only Portea.
Yeah. Because I was doing that full time as the CEO, so so I didn't want to take up any of the others. So
अच्छा ये Portea के बाद ये सब किया आपने?
Portea के साथ. 2011 we started all these.
Okay.
So from 2011 onwards, we've been in Portea. We started only in 2013. So before and after that, a lot of companies have been promoted.
Okay, very interesting, But in the renting space, the margin is higher than the selling space of equipment.
Yes, of course. Yeah.
Okay.
Yeah. Because but the only the downside, if I may call it, is that you have to hold the inventory. So you have to invest in many crores worth of inventory if you want to make
this business.
This business requires a lot of capital, which we have invested. So for us, it's a good business. We like it.
And like, what part of your business is equipment leasing? Like, what's the percentage?
So actually, we have three businesses, and we have spoken mainly about the home care business.
Correct.
That is services that go to people's homes and provide different healthcare services. So that's probably about 40-45% of our revenues come from there.
Yeah.
Then we have the medical equipment business, which is probably about 30%. And then we have a pharma business where we work with some of the top pharma companies, and we do a lot of different kinds of services for them. We do distribute some products, so there's some distribution revenue, but only for specialized products which they don't distribute through your normal pharmacy. These are these are products which are still under patent and very expensive products, maybe cancer-related drugs or arthritis-related drugs. So those drugs we distribute, some of them. But a lot of services we provide, helping them manage their patient populations, doing medical services for their patients and all of that. So those are the three. So the balanced revenues comes out of that.
And what's the margin in the pharma business?
The pharma services has got similar margin profile as the healthcare services. Pharma distribution will have lower margins. Those are some maybe 10% kind of margins. Whereas any service margin will be typically in the 30%.
Okay. But like in terms of the distribution, do you keep an inventory ready or do you do it only on the order basis?
Now, we do keep an inventory, but most of the time it's on consignment basis. So so we have to pay them after after we sell the egg. So we don't carry the inventory on our books by spending our capital.
Yeah. Okay. That way you make it more efficient.
That's correct. Yeah.
Yeah. Oh, interesting. And like you said, this is like a very capital intensive business. So, and you've of course been a serial entrepreneur, so you have a network of investors. But
correct.
How did you initially raise money to start this in 2013? Because at the starting point itself, you needed capital to run it. You couldn't like wait for the idea to get validated and then start. So, how was that journey?
So, like I said, this was not my first gig.
Yeah.
So, we had already built some businesses, exited and so on. And we had a fairly good connect with a number of investors. So, the first round we raised from Venture East and Axel. These were the two key investors. And then as we, about 6-8 months, a year down the line, then Qualcomm also wanted to come in, and IFC also wanted to come in. Part of the same round, they also came. So we knew the people, and that helped us to.
And how much like was your first round for, which gave you the capital to start?
The first round was, oh my gosh, it's a while back. I think it was about 8 million or 7 million.
Oh, not bad, yeah. At that time.
Yes, yes.
And like, how did you use the funds? Like, in
a lot of a lot of it was in technology platform. Second was in just creating the operating model, setting up various offices, starting the to hire people, train them, build the brand, all of that. We even, I don't know if you recall, you may not, but in 2015, 2016, we even did a above the line marketing. We had some television advertising, newspapers, hoardings, all of that. So that really gave us a huge brand recall. So pretty much Portea was synonymous with the home care because of the work that we did at that time. And then we've been consistently working across multiple cities and built the business. So so that's and that's how the brand got built over the years. But
do you think the amount that you spent on marketing and branding, it gave you return double than that?
I don't know, double, single. I'm not sure how to validate that. But a lot of the spend went in building a brand also. But thereafter, most of our marketing was performance marketing. So direct to customers, of course, we used to do, and we still do, we do all of that. We don't use Facebook very much now.
Instagram.
Insta, then Google and so on and so forth. But a lot of customers now come to us because of referrals, etc. So that is our B2C and SEO, all of that. So all of those things are there. So paid marketing, SEO and referrals, that's how our customers come to us. And then when it comes to the hospitals and so on, there is no, it's a team of people that we have. We have
for the outreach.
Sales team that calls on the hospitals, doctors, and they then provide us with leads which we fulfill.
Yeah, okay. And then you said you used to advertise on television also.
We did for a short while.
अच्छा, तो कोई ऐसा viral campaign हुआ था आपका जिसमें बहुत सारे फिर leads आ गए, बहुत views आए थे उस पे?
Not. It was, I don't think there was so much of social media in 2015. That is more in the last.
But उसके बाद you all didn't.
We didn't do any television campaigns or above the line, but it was all more below the line, more localized marketing, and of course social.
But in 2013, how did you create a brand तभी?
2013 में तो brand नहीं था ना, उसके बाद ही 2013 it was all about
hospital too.
One is hospital. So we did two things simultaneously. We started to do paid marketing and getting some customers through that. Paid marketing in SEO we started right up front. But we also started to work with hospitals. Now working with hospitals gave us a lot of credibility. So people know that if we are supporting Manipal Hospital and their patients, then we have a certain quality and they can rely upon that. So Manipal, the original Columbia Asia hospitals, Manipal, These were our initial Fortes. These were our initial customers. So when you have these big names, then people feel confident that you're probably doing a good job.
Right, right. But since you already had a network to start, you could do it. But for example, if somebody has to start today in this era, something like Portea, what do you think are the barriers to entry?
There's a big barrier that we had for entry, which we have now removed. So it'll make it easier for a lot of people. At least people know the perception and the acceptance by hospitals and doctors. That's a big barrier that we had that they don't have to. But today, for anyone to set this up, you have to get to a certain economic size for this business to make sense. It takes a lot of effort and time. So you need to be willing to stick it out. You can't do a very small subscale business and make economic profits out of that. So you have to just wait it out. You need to have some capital so that you can scale it to a size where you are able to make it economically viable for you.
Yeah, you broke even after 10 years, right?
It's taken us. Maybe somebody who comes in now because they don't have to do the whole creation of the industry. They may take 6-7 years to break even, or 5 years they can break even, but it still takes time.
Yeah. What is the biggest cost in setting this up? The technology or the manpower?
Technology, manpower, and if you're doing medical equipment, then the inventory for that. Those are the big costs.
Yeah. Understood. And since you're now in 40 plus cities?
Yes, we cover 40 plus cities. We have offices in about 20 odd.
And which geographical area has been the best performing for you?
All the big cities are doing well for us.
All the metropolitan.
All the metros are good.
Got it. And like in terms of your expansion strategy, how do you go about it? For example, you have to set up in a new city. Then like what is the process from the scratch to make your presence felt over there?
So if you go into the new city, so as far as digital marketing is concerned, that is centralized. So we can decide to, if I want to start in Ranchi, I will start, doing marketing which is focused on Ranchi. But the more important thing is to go and build the local relationships there. So meeting doctors, hospitals, setting up those relationships so that they know, because that's the B2C will happen, but we need to make some effort to get the B2B relationships going. So that becomes important. But even before we get into a new geography, we'd probably spend enough time to understand what is the buying behavior of the people there. How much are people focused on their health? What are they willing to spend? Are they willing to spend on something like home care? You need to do a little bit of effort to find that out before you decide to enter that city.
Correct. But right now, the preventative healthcare market has picked up a lot.
Yeah.
Especially after COVID, people have started to realize prevention is better than cure. So are you seeing an uptick in the diagnostic segment and in other services that you have in the preventive healthcare space, especially after COVID?
We are not big on diagnostics because diagnostics, that's and everybody will do home delivery or home pickup of samples. So there's no differentiation there. For our customers, if anybody needs, we will fulfill that. But we don't go specifically to acquire customers who want labs, lab services at home. So we don't do that big time.
What is that one service that you have that nobody has today? Is there anything like that?
See, what is different is the combination of services. Somebody will have one little bit, somebody will have another little bit. But when they come to me, you get all of it. And when everything works together, then the patient has a very seamless journey. And things, there's no finger pointing that this happened because of that or the other. We take full accountability end to end. That is a huge benefit for customers. And, they don't have to worry about it so much. They know that things will get done end to end for them in one place. So that I think that's a big differentiator.
But I also want to touch upon this insurance part and out-of-pocket expenses, because in India, I think 65% of healthcare spend goes in out-of-pocket. And in terms of the insurance coverage, companies are still yet getting accompanied with the home healthcare facilities. So how did you see its changed from 2013 to now? How the landscape has evolved in the insurance space?
Not enough. We still, insurance companies are still not covering big time all the home care requirements. Little by little now, in fact, after COVID, they started to take it a little more seriously and they are starting to cover. But still, it's a long and hard journey to convince insurers to cover this piece of service, because as of now the whole thinking of insurers is that the only thing that they will cover is when somebody gets hospitalized. From there they have to move to other services, that is continuum of care. Somebody has been discharged from the hospital, they need physiotherapy, it's part of the same treatment. Can I cover that? So that's the first thing that they have covered. Now, for them to say that instead of going into the hospital, if I want to treat at home, will you cover? Some people have started to pick that up. For instance, Star, Niva Bupa, some of in ICICI, some of them have started to offer packages which cover these things.
Yeah, why do you think these insurance companies are not covering these services? Because their margins are lesser in this space than what they would get in hospitals.
No. See, what happens is insurers need data that tells them. See, how does insurance work? 100 people will buy will pay the premium, and maybe 2 will use. That's the model. Everybody does full 100% claims. Insurers will go bust. They don't have enough data that tells them what is going to be the profile of the home care industry. If people pay a premium for home care, how many will use it? What will be the spends of that, the claims to premium ratio? They don't have enough actual data for that. Till that gets built up, they will always struggle.
So you think it'll take more 5-10 years for that too?
Well, I'm hoping more 5 rather than 10, but yes, it's going to take time.
Got it. Although, since we've talked a lot about Portea and you've been a serial entrepreneur, so I would like to touch upon the other 2 businesses also that you've built quickly, just to, sum up. So you said that you were the first one to start a BPO company in 2000 when nobody was doing it, and it got acquired by ICICI. So just tell me about that journey of yours. How did you come up with the concept? And how did you get ICICI, a conglomerate like that, to acquire it at that point in time when the concept of startup was not even in place?
Sure. So this was the year 2000, and I used to be working in Microsoft, and I was keen to see if there was a startup that I could do. And I started to study the whole customer service space rather than technology. I didn't want to do a technology startup, so I was studying what was going on in the customer service space, and it looked like there was a disruption that was coming up there, and that led to the idea of creating an offshore customer support company for internet businesses. That's how we started, and then it evolved. Various things happened. I had other co-founders, 4 of us together. We sort of put the business plan together. We raised a small round, looks small now, but at that time it was a big round.
How much was it?
It was about $2.5 million in 2000, which was a big sum for us. So we started and we built the business. We went through a lot of ups and downs because we started working with internet businesses, and then that was the Web 1.0, and there was a huge decimation of all the Web 1.0 companies. There was a full-fledged crash in 2000. So we couldn't build the internet business. So we decided to move towards the BPO, that we'll do a call center, we'll do data processing, etc. So for that we had to raise a different kind of capital, because it's much more capital intensive. Correct. We were doing that and well on our way. Then 2001, 9/11 happened. So the entire, nobody was traveling, there was no business, no customers, no clients were coming to visit us for us to get new clients. So we went through ups and downs, but then we stabilized, and then the business did very well. In 2003, we sold the business to ICICI because at that time, I don't know, if you study that, you'll see that 2000, along with us, few other companies started in the BPO sector. And all of them then started to align themselves with large technology companies or banks. So because it was felt that it needed that a large integration with technology for technology companies. You know, they're providing technology solutions. They'll offer this also. Or if they are big BFSI, they have customer needs. This is something that aligns with that. So that became the general strategy. So most of the companies went for these alliances. So we were one of them who did that.
So did ICICI approach you directly?
That's right, yeah.
Okay, interesting. And then after that, how did you think of starting Tutor Vista, which was like your second one? I'm sure you're like a restless person. That's why you're like, ab kya kare? You can't like just rest out.
Yeah.
So how did it start? And then it was acquired by a British publishing giant,
Yes,
Pearson.
that's correct.
How did that inquiry come in? Just shortly tell us about that too.
So in 2008, Ganesh actually started Tutor Vista along with Srini, and I was still working with Tesco after. Actually, they started in 2006. Sorry, in 2006 they started Tutor Vista. Ganesh and Srini started that, and they were looking at tutoring the global market with Indian talent, and that business had started to pick up. I used to be with Tesco after I exited ICICI OneSource. It became customer asset became ICICI OneSource after the acquisition. After that exit, I took up a role as the founding CEO of Tesco's offshore entity in India.
Okay.
So I set that up, and in 2008 I exited from there, and I joined these two guys. They were just sort of building up the business. I joined them as the third co-founder, and then we built out both the international and the domestic part of Tutor Vista from 2008 to 2013. And
so it was supplying Indian talent to global companies.
No, it was we were doing tutoring. So US students, when they needed help on maths and English, our tutors from India used to teach them. Online. It was online tutoring for the global market.
Understood. And then how did Pearson acquire it?
Pearson actually came in as an investor in our Series C, and they were strategic investor with the intent to see whether they should consider acquiring, and then that got fructified about 2 years after they came on board.
Interesting. And then you were discovering your next one, and that's how Portea came about.
Portea and all the whole bouquet of other startups that we have promoted. Big Basket, Bluestone, Home Lane, Hungerbox, Verloop, and so on.
Interesting. It feels like your hunger is never gonna die. But I think the time has died.
Yes.
And I can see you already
My
tired.
voice is also died.
Exactly, yeah. But I think we've covered mostly everything, and it was really a pleasure to have you. After 2 hours of travel.
I hope I don't have to spend 2 hours again to get back to my hotel.
Not at all. Actually, I took this interview for a longer time so that the traffic gets cleared up and you reach hotel safely.
Thank you so much. It was a pleasure meeting you and having this conversation, and thanks for the yogurt.
Although it didn't feature, but yeah, Epigamia, they're not sponsoring us, so we're not showing them. But cool,
Great.
Thank you.
Thank you so much.